it's your anxiety therapist. So today we are going to talk about ADHD. What does it look like? Why do you need to know? And how do we deal with it? So we're looking at symptomology and challenges in a client's life. We're looking for three potential things: hyperactivity, inattentiveness, and then the third type is a combined. So you'll see symptoms of hyperactivity and symptoms of inattentiveness. So inattentiveness means having a hard time paying attention, such as daydreaming. You'll often see these people looking out the window or thinking about other things while something else is going on in front of them. Doesn't seem to listen. So if someone's talking, they're kind of zoned out thinking about something else or hyper-focused on something else. They're easily distracted. Any noise or any movement, it's a jump in attention. Does not get details, makes careless mistakes because they're jumping from one thing to the next and they're not paying attention to the little details. Loses important things like wallets, phones, tools, or do homework. They're just putting it down as and not thinking and then going on to the next thing. Does not follow through on instructions. So hyperactivity, always on the go. You will see them jump up and move around all the time. If they're in a situation like class or work where they can't jump up and move around, you'll see their legs shaking or other things that show the restlessness. They talk too much, so they'll blah, 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 and they'll just go on and on and on. They don't really know where to stop. And then for kids, of course, like the impulsivity part of it is running and jumping and doing when they're not normally allowed to be doing it. They just need to go do it. There's also stims, and that can also be the restlessness internally. So rocking, nail biting, picking. You can tell sometimes they'll be rubbing their legs or their legs are shaking. So anything that's repetitive that kind of looks like a self-soothing or a need to move. Impulsivity, frequent acts and speaks out without thinking. So this is normally going, oh, I want that, and grabbing it. Often you'll see the kids like see them playing with some other kid and they'll just like grab what they want. Oh, I want to play with that, and they'll just grab it. May run into the streets without looking, as in, I just want to go, and they just go without thinking. Trouble taking turns. If they're not moving, they're feeling really restless and really irritable. So just sitting and waiting is really hard for them. Cannot wait for things. So waiting is just that constant need to keep moving, and they cannot wait. Calls that answers before a question is completed. So for instance, a teacher says, an example of a test question is this, and the ADHD student would just answer the question because it just kind of comes out. And same thing with frequently interrupting others, as in can't wait turns to finish the sentence to express what they're thinking. It just kind of comes out. So oftentimes it'll be intense, or it'll be before someone's finished, and it'll be like really excitable. So when we're looking at the diagnosis for it, we're not just looking at these things. There's other things that can be really predominant in ADHD people. So rejection sensitivity is a really big one. They think that everything is about them. They think that when everyone's looking or at them funny or doing something different, then they automatically assume that means that the person doesn't like them or isn't enjoying them, and it becomes about them. When you have that collective narrative all the time, you tend to have pretty low self-esteem. So these adults or children will feel like nobody likes them, or feel like they're very worried about proceeding or doing something because their concern is that people won't like them and they won't be good enough. They can also hyperfocus. So when they get excited about something or they get something on their mind as a goal, it becomes like tunnel vision. So if you have somebody who's hyperfocusing, you often have to make sure that they're looking at you before you're speaking, because they're not really hearing what you're saying if they're not actually looking at you. Because of their inattentiveness and excitability and their emotional reactivity, they often feel stupid and inadequate, according to their coworkers or their peers, who always go, oh, that test was so easy. And the ADHD people are thinking, well, I really had to study very hard, and I had to find I had to work extra hard to focus to learn it and everybody else seems to be doing it really easily. I must be stupid. Same thing in it for work, for adults. They feel like everybody else has a kind of easier time, and that means that they're inadequate. The fight or flight can become really reactive. They're already feeling restless. So when they feel overwhelmed or inadequate, that feeling can like rush over them really fast. Procrastination. So people with ADHD really only know the now and then the not now. So not always, but if it's not now, then it feels really far in the future. So they can really only do things when there's the now. And that also helps the intensity with the focus. So somebody with ADHD may not work on a project until the very end of the due date because it's not now. And then ADHD paralysis is when things are so overwhelming, they'll look at a big project, a big homework packet, and they just don't even know where to start. So they just don't start it. And so that's a really important concept for ADHD kids, because if you go line by line or paragraph by paragraph, it can help them to feel like it's doable. So it doesn't become so overwhelming. Okay, how do we diagnose? So when we have a client or a potential client who has possible ADHD concerns, or they're even their parents or their family or themselves are worried that some of these things are not quite normal and maybe you want to get assessed, we ask the specific questions about how their life works, how their challenges are, what other things they could be experiencing. If we feel like it's a reasonable diagnosis to think about it, then we will give them a self-assessment. They can fill it out, and or the family members, usually for a child, the parents will do that. And then we can also give it to the teachers if the teachers are noticing some kind of disruption in the classroom. If the self-assessment comes back as impairment in some of these things, then we can do a QB test. And that is a 20-minute sit-down test that we do at the office, and they just answer questions, and then it sends us a really accurate report on their brain activity. And it compares their activity to other people in the same gender and in the same age bracket. So we'll be able to tell if the impulsivity is high, if the hyperactivity is high, if the inattentiveness is high, or if it's more in a normal range. When we know what more the diagnostic conditions are, we can help on coping skills. We know best which areas we need to help them with. And then if they're interested in medication, and if medication is something that would be helpful for them, we can assess it after the medication has been started to see if they're now in that normal range. If it's under dosage or over dosage, we'll see that in the testing. So we'll know what's appropriate and what's not. Why do we want to diagnose it? So if any of these things are familiar and you feel like you or your child needs to get diagnosed, I highly recommend it. You can talk to a mental health professional or call us. And schools and workplaces have to offer accommodations. Once you get a diagnosis, they have to give you appropriate things to help you do your job better. So medications can be helpful. There are stimulants and there are non-stimulant medications, and you'll have to talk to your doctor or a psychiatrist about which one would be best. But there's a plethora of options to try. There's short acting, there's long acting, there's low dosages, there's high dosages. So depending on what you feel like you need or what they think you need, there are certainly different kinds of medications that you can try. There are also brand new ADHD video games. So Endeavor RX comes from the doctor, and it's basically a video game where the kids have to sit and focus for 25 minutes a day in doing pretty intense focusing, which the thought is that it strengthens the focus for the child. In most studies so far, it's fairly new. It looks to make a difference for a year, maybe two. But it's not a long-term solution, but it can definitely help if you feel like there needs to be a little bit of help with your child. Okay, so just as examples, the schools can offer accommodations that can really help these ADHD kids. So for example, either extra or untimed tests. extra note takers in the class or audio versions or recordings of the lesson, because if the kid's not really paying attention and they miss even a second, there's a bird outside and they're looking outside, and then they have to like readjust and come back to the lesson, they might have missed a really important concept that then gets everything else very confused. So being able to see it and hear it sometimes can help bridge that gap of information. Short answer tests instead of multiple choice. So for somebody with ADHD, they have a hard time with multiple choice because usually there's 2 answers out of 4 that are pretty obvious that they're not the case. And then 2 of the answers will be very similar, and you have to take apart that question to get the right answer. If you get the question wrong, you get the whole question wrong. If they're doing short answers, the teachers can then tell that they know the material, it's just not being tested on that certain kind of question type. So oftentimes they can write out everything they know and they know everything about the topic. So it helps them to show their knowledge and raise their grades. Extra times for assignments. If somebody is having a hard time getting started or they're feeling overwhelmed, then giving them an extra couple of days will help them to feel less overwhelmed. Allowance for the students to leave the classroom is needed. So if they're feeling panicky or they're feeling restless, they can go out to the class, they can get some water, go to the bathroom, and then come back. And then also the teachers can help. So it definitely helps the kids to have the diagnosis, and if they get all the accommodations, they can pick and choose the ones that they're comfortable that they need. They don't have to always take all of them. Okay, so if you are an adult and you have ADHD, here are some tips. So daily calming is key. Our nervous system needs to calm down. People with ADHD have very intense emotions. They feel things very strongly. And so when our nervous system is calm, we can decide what is logical and what is emotional, and we can navigate these experiences much easier. Organize. So task lists, task calendars, there's a lot of things online that are free or really cheap. And if you're taking 15 minutes a day to just organize your task list of either priority or due date, it'll really, really help. If you can limit distractions, right? Putting your phone on DND, ask a coworker not to disturb you, right? Put on some soothing music, whatever is pleasurable to you. Give yourself a break and get up and move around after the time is up. Don't keep moving because you'll get fatigued. Trust yourself. And the noise cancellation headphones are really great for limiting distractions. If you are in a workshop or a meeting and you tend to lose focus, you can write a lot of notes during the meeting, because if you're writing, your brain is staying engaged. And also, if you're not remembering everything, then you can go back and reread your notes. So it really helps to, if you're going to organize, not just the due date, but you take the amount of time that you have to work on it and literally put in the time that you're going to work on it in that time frame. So knowing that you have 30 minutes where you can really focus on something, then give yourself 30 minutes a few times before the assignment or the project is due, so that you can really give yourself that time. If you're just pooped one day, you just move the date another day that you think is more appropriate. So flexibility will be important, but just having it there so that you can see it will really help. Okay, if your child has ADHD and you are a parent and you are challenged with all of the things that it comes with, here are some suggestions. So children with ADHD have very strong emotions. Make sure to help them name their emotional experience and how it feels in their body. You can work on calming this part of the body as needed. So kids will normally feel their stomach get tight, their shoulders get tight, they'll get headaches. So in order to say, it's okay, you're feeling really overwhelmed, it's okay, you're feeling really frustrated, it's okay, I'm going to help you. Take some deep breaths if your stomach is feeling tight, relax the shoulder, whatever you need to do, because the kids will feel it in these parts of their bodies. You can relax it for them. Children who have different cognitive functionings often have lower self-esteem. Compared to their peers, they feel really inadequate. So it's very important to honor their differences, help them with techniques, and let them know their brains are just as good as others. The ADHD brain is made to protect other people. It's supposed to hear all of the things that you need to survive, right? You hear all the bears in the woods, and all these distractions are really good for keeping everybody else safe. But it doesn't do well in a classroom environment where you have to just look at one thing and that's your job for 8 hours. So it's a harder environment for kids with ADHD, but that doesn't mean that their brain is any less than the other students. It just means it's 4 different things. When they become adults, they're going to be really creative and they can think of a whole bunch of different solutions for things. And there are jobs that do really well with the ADHD brain. It just doesn't look great in our current school system where you have to just watch one thing. So children with ADHD often get very overwhelmed in projects. So you can help them by building and helping them chunk time. Just like I said, doing like one problem, one paragraph, one page. Oftentimes they have a harder time seeing the bigger picture. So in order to explain not just what they're learning about, but how it fits into the bigger picture can help them understand it better. So it's not just paying attention to the one thing in front of them. That'll help them understand in a higher concept. Kids with ADHD are usually pretty good at theoretical things, so it can help if they understand that. And then of course, the due dates and the working backwards. If you know your child can do 15, 20 minutes each night, then give that to them and just make it in the schedule so that you have the appropriate time before the due date. Children with ADHD have a hard time transitioning from one activity or topic to another. So they're sitting around, they're watching TV, or they're writing or doing artwork, and you say, okay, it's time to go. It can be really jarring for them. They have to process that transition. So you have to give them time. Okay, we have to go in an hour. Okay, we have to go in 15 minutes, right? So I know that's not always realistic and possible, but when you can, try to give them transition time. Hey, at 3 o'clock, you're going to have to do your homework, right? So do what you're doing, and then at 2 o'clock, you walk downstairs or walk upstairs to their bedroom and say, okay, it's now 2 o'clock. We have 1 more hour. You got to do your homework. And if you give them time frames, then the processing happens as you're reminding them, and you are more likely to get a quicker transition and less frustration if it's 3 o'clock and it's time to do this next activity. This is also hard for them if they're in the classroom, having to go from one class to another. They want to sit and they want to organize and they want to process kind of just what's happened and what they've heard and what they need to do before they're onto a whole other topic. Their brain's kind of having to reprocess everything. So sometimes the school will let the kid go to the next class a little early just to like sit down and just like program and process for a minute. So it would depend on what your child needs, but sometimes, most of the time, they have a really hard time with transitioning. So that is ADHD. If you guys have any more questions or concerns, please reach out. We are more than happy to help. We have play therapy and art therapy and all kinds of things to help kids. And we are very versed in the adult ADHD world and how to help adults. So feel free to reach out. We are available 301-818-8100 or info@careofselfcenter.com. Thanks for joining us. Bye.